Good morning, all. This is Sandy Cashmark, Executive Director, extending a welcome from Tri-State Manufacturers Association and from Central Minnesota Manufacturers Association. My office has partnered with MPMA to bring you this webinar series on manufacturing solutions. And our intent, of course, is to provide content that is especially relevant and useful for manufacturers. Thank you for joining us today for session 4 with a focus on proper cleaning and prevention. Thank you.
All right, thank you, Sandy. Good morning, everyone. Again, this is Steve Kalina, the President and CEO of the Minnesota Precision Manufacturing Association, MPMA. One thing that I covered pretty extensively on Tuesday's webinar session was the recommendation to connect now with other similar businesses and utilize the Medical Alleys Resource Connect and Minnesota Chamber Supplier Match. Those links are on our slideshow right now. With the numbers projected in Minnesota and the country, we must prepare for our labor forces to be drastically diminished in the coming weeks with little to no notice. Whether you need resources or you need work, it's imperative to start that communication now and build those relationships so we can more easily shift production or resources on a moment's notice. So I encourage you to look into those resources and make those first steps of communication. Related to that, I mentioned on Tuesday that we also made a proposal to State Representative Barb Haley for 2 legislative or perhaps executive orders. First, a Good Samaritan type protection for employers that make decisions in good faith to protect employees or essential operations. And second, we're looking to lessen regulations or obtain waivers for short-term or immediate needs to move production of regulated work, as well as address protection from labor laws, collusion laws, insurance conflicts, and challenges with contracts and employee benefits. That would make it extremely tough to exchange work in normal times, as well as labor or shared resources between companies. Realizing that these were more federal issues, we had a discussion with Congresswoman Angie Craig's staff this morning and are looking at next steps at the national level. You're probably all receiving information on the CARES Act that was passed on Friday, March 27th. The Paycheck Protection Program, PPP, is an important part of this and a great resource for businesses to maintain payroll as long as they're keeping employees on staff. Many of these loans will actually be forgivable. I encourage you to view a webinar put out tomorrow, April 3rd by CBIZ, and follow some of the resources that are given to you by many of the law firms and CPA firms that you're probably seeing lately. So I encourage you to look into that. If you're not sure if you that the loans apply to you, I encourage you to still go in and apply. If you're not sure if you're going to need it, still go in and apply. The SBA is basically telling everyone just apply, and if you don't need it later, you can always turn it down, but it's better to have it ready and available when you need it. And just a reminder that you can find these webinar PowerPoints and recordings on MPMA and TSMA's resource pages. You can also find other helpful information and resources that we've compiled. So on to our main topic. Today we are diving deeper into the appropriate preventive and responsive measures to keeping your workplace and your most important asset, your employees, protected. We've implemented the basics at most companies, but now more than ever, every employee and every interaction and handoff is so critical. Cindy Banshee of Vanguard Cleaning will share with us how to take appropriate precautions and using the proper chemicals. Cindy?
So I'd like to start with talking about surfaces. The National Institute of Health did a study recently and published in the New England Journal of Medicine. And it found that the SARS-CoV virus survives up to 24 hours on cardboard. That's why we're hearing that number a lot. It's coming out of this study. And we're also seeing that plastic and stainless steel can last up to 2 days. So again, that's why we're hearing a recommendation once an area is infected to stay away from it for 2 to 3 days. And just for interest, copper only takes 4 hours for it to die. This means that the virus can last longer on door handles and plastic and laminated work surfaces. So this is the reason that people are starting to do a lot of touch point cleaning. It also shows that if we are trying to inactivate the virus, disinfecting the surfaces with alcohol is very effective. It takes only a minute. Interestingly enough, high temperatures will also kill it at least kill the SARS virus, and they don't know about the COVID-19, but they know that temperatures of about 132 degrees Fahrenheit will kill the virus. If you go to the next slide. Many times we don't know what the difference is between these terms, and it doesn't matter. But at this point in time, it really does we need to understand the difference between what a cleaner, a sanitizer, a disinfectant, and a sterilant are. A cleaner will actually remove the germs, but it won't kill them. We many times interchange sanitizers and disinfectants. Sanitizers are what many of us are using to wipe down the surfaces, and that's fine for day to day. But in this situation, we really want to start looking at using disinfectants. They actually kill the fungus and the bacteria, and they don't spread bacterial spores on the hands of the environmental surface. So if you go to the next slide. The question is, which chemicals should we actually be using that are the disinfectants that are recommended? The EPA has put out a list. It's called the N list. So if you are looking at a product, you should look at the back of the product and go to this list and compare it. If the numbers match, even if the names don't match, you can use that product. The list, I have put a link to that list in the resources. This list also includes products with emerging viral pathogen claims and those with human coronavirus claims. If a product with an emerging viral pathogen claim is not available, then use the product with a coronavirus claim as long as the numbers match. If you go to the next page. Many of us are struggling to find personal protective equipment, or PPE. If you don't know the definition of that, it's the gloves, gowns, booties, masks, protective eye equipment that we're all trying to find. If you are searching in the order of need, gloves are by far the most important, then masks, eye protection, gowns, booties, and then actually hair. Gloves and gowns should be immediately removed after cleaning a room or an area, and proper removal following the CDC guidelines will avoid contamination of the wearer and the surrounding area. If a PDP equipment is used to clean up the COVID-19 area, it should be placed in a biohazard bag and disposed of properly. Make sure to clean hands after removing gloves. This is really critical to contain the virus. And there are resources to show you how to properly don and doff the personal protective equipment. I have put a link to that in the resource guide. So if you are not sure how to do that, you may want to go there. So now let's move on to workplace controls. And this is the facility itself. These are some quick and easy things to implement. And I know many of you are already doing this, but it's a good reminder. Everyone should be putting up hand washing signs in every restroom. You should also be putting up cover your cough signs at every entrance, including the main entrance. When you think about soap and towel dispensers, make sure that someone is checking to make sure that they're full at all times. It's frustrating for people if they're trying to wash their hands and you don't have the chemicals available for them. You may also want to consider installing an automatic dispenser, again, to keep people from having to touch the dispensers. Installing antibacterial hand sanitizers in key locations is also a very good thing to do. You want to put in at least 60% alcohol. If hands are visibly dirty, use soap and water and don't use hand sanitizers. And make sure that you designate someone to check for supplies and let everyone know who that person is if they are running low, so that person can continue to fill these vital containers. Provide tissues as well, and if you can put them in no-touch disposable receptacles when they've used them, that would also be very good. Shut down water fountains if you can, and supply bottled water to employees. Provide disinfectant spray and wipes to wipe down machines and work areas. And again, make sure everyone knows the key contact. You may also want to give employees time at the end of their shifts to make sure that they can wipe down all the work areas. And of course, provide personal protective equipment, and like gloves and masks. Now we have gloves here, and I'm going to give you the name of a few other suppliers at the end of the presentation. But there are gloves available. Masks are much harder to come by. And I think everyone knows that people are starting to make them. There is a group out there called the Million Mask Group, and they are making masks at home. There is a group here in Minnesota doing that as well. And if you need more information, you can reach out to me. If you go to the next page. This relates to actually engineering controls in the facility. These don't rely on workplace behavior, and they can, over the long run, be pretty cost effective. And they are more long lasting. Installing high efficiency air filters or increasing ventilation or adding air purifiers can help a lot. Sunbelt in Bloomington is actually building new air purifiers. So if you want those, you can reach out to them. Increase the percentage of outdoor air circulating if you can. And install physical barriers such as clear plastic sneeze guards on the production floor. N Parallel is a company here in town that is pivoting and actually making these kinds of barriers. So they're also making social distancing floor graphics if you need those kind of graphics. When it comes to shipping and receiving, there are a few things that you might want to think about. You may want to put an area to the side and designate it for packages coming in for up to 24 hours. I know that that's a difficult thing to do in shipping and receiving, but again, it may save people over the long run if we don't have to touch those packages. The other thing that's happening is, and this is more expensive solution, but radiating packages, that's what the post offices are currently doing. And finally, if you're looking at class 10,000 clean room, you could install pass-through windows or HEPA fan filter units. Again, workers can always garb up with booties and even bunny suits and gloves and masks. You may also want to think about putting up a strict curtain at the entrance. So if you want to go to the next page. Touchpoint cleaning is going on in about 100 of our customers right now. I'm going to tell you how to do this yourself, but it's also something you may want to reach out to your current cleaning company to have them do. Touchpoint cleaning focuses on common areas and locations that are touched frequently by several people throughout the day, such light switches, doorknobs, and elevator buttons, and other common areas. And again, because they collect these germs and they may sit on the surfaces for 2 to 3 days, we recommend cleaning those areas at least twice, if not 3 times a day. This is probably one of the most effective ways to keep a work environment clean of these viruses. So on the next page, the process itself. If we're looking at a surface, you actually have to clean the surface first with a microfiber cloth or an all-purpose cleaner. Unclean surfaces can actually leave dirt that the disinfectant can't penetrate to reach the surface and ensure uniform disinfecting. So disinfecting means putting on protective gear and disposing of it properly. The EPA registered chemicals are applied then, and we need to allow the allotted dwell time. So if you're checking the bottle, you need to check the label and see what the dwell time is. This can take up to 10 minutes in order to let the disinfecting agent latch on to and destroy the germs. So sure, if someone is doing this, that they do use the time and don't wipe it immediately, or you will basically not allow the germs to be killed. We also recommend moving from one side of the room, spraying it down, and then moving around. And once you hit the dwell time, move back to the beginning of the room and start actually wiping it down. You don't want to leave the chemical on the surface, as it will actually damage the surface. Do you want to move on to the next page? So Tom Sellen on Tuesday had some great recommendations, and I want to just repeat them again. Visitors, if you can get away with not having any, that's the best thing to do. If you have to have them, you should isolate them, only essential workers talking to them, and in a separate area. Drivers, don't allow them in. Use them out. Use any kind of outside speakers, cell phones. Have them pre-assign the paperwork. Deliveries. Make sure you have a protocol for shipping. Tom suggested calling ahead to consignees, and make sure you understand your supplier's code, as well as how many times the material has changed hands. As far as the employees are concerned, have them avoid using each other's phones, desks, production areas, and other work tools, if possible. If it's not possible, have them clean and disinfect them immediately after using them. Disposable wipes are probably fine for this, but if you can create a bottle of disinfectant, that might even be better. Promote hand washing and provide alcohol, as we talked about earlier. And make sure that the covered cough and sneeze signs are up. And make sure PPE education happens. People think that they know how to put this equipment on correctly, but they may have never put on a gown or masks before, and it should be part of the ongoing training. So next page, please. So what happens if you actually have exposure? If you go to the next page. The first thing to do is make sure that people feel comfortable with self-monitoring and identification. I would recommend that you have an isolation room designated, but if you don't, At least designate an area with closable doors away from workers, customers, and visitors. Isolate infected workers until they can be removed from the workplace, and provide a face mask to that person so that they can wear it to limit respiratory secretions. Restrict personnel entering that isolation area, and you need to advise others in close contact and potentially send them home as well. Immediately close that area of the business. Next page, please. So once that area is closed, internally, you want to think about shifting that work to another area of the facility or even another site. You may want to start thinking about utilizing cross-trained employees or temporary workers in that area as well. Externally, you really want to start getting a company that has the equipment to come in and clean and remediate that area. We do that. Paul Davis, ServPro, and maybe your current cleaning company. As far as cleaning guidelines, and these are changing all the time. The virus can be stable for several hours to even days on a surface pointed out at the beginning of the presentation. So close off the area that was visited by the ill person and improve the ventilation. That might mean opening doors and windows and using ventilation fans to increase air circulation in that area. Wait 24 hours as long as practical before beginning cleaning and disinfection. Make sure that the person going in has the proper PPE and EPA approved disinfectant. Every room infected by that person that has to be cleaned. And so you need to kind of trace through where they've been and remember to look at places like bathrooms and break rooms as well. So then make sure that the person going in does the correct cleaning, and if possible, follow it up with an electrostatic cleaning. Now, there are foggers out there as well, but the foggers really are meant for outside areas. The electrostatic cleaning isn't required. You may see people coming in with atomizers instead, and that's fine as well. The difference is that the atomizer will just touch the surface of soft areas, and electrostatic will wrap around the soft surface more. You may also want to think about carpet cleaning. On the soft surfaces, anything that can be put into the laundry should be, and anything that laundry has touched, including hampers or any other containers, should also be cleaned. If an area has more than 7 days since that person infected has visited or used the facility, additional cleaning and disinfection is not necessary according to the CDC. So if we move on to contingency planning. Recommendations are to develop essential functions that are in your business and thinking about them to make sure that you can maintain your critical functions and operations. So identify alternate suppliers, prioritize existing customers, or temporarily suspend some of your operations if needed. As Tom indicated, indicate alternative supply chains for critical goods and services, and talk with business partners and customers about your response plans and share best practices. Could you move on to the next slide? Absenteeism. If you think about how you will cross-train employees to perform essential functions, that will go a long way if key employees are absent. You may want to consider temp workers as well. Multiple locations. Think about giving authority now to location managers to take appropriate actions in outlining your plans. And cross-train between locations as well, in case one location has to be shut down. And communicate now, as I indicated, with business partners, customers, other manufacturers. Determine if you can move into their locations if possible. Even consider your competitors. Post-infection policies and procedures. These are pretty basic, but you want to think about how people can report infections and work area closures. You also want to think about how you're going to communicate all of this to your employees. You would definitely want to have policies and procedures ahead of time. And even think about returning to work, because one day hopefully we'll all be back to normal, and you're going to want to explain to your employees how that procedure will work. Can you move to the next slide? So in determining your planning, again, pre-infection policies and procedures, we're seeing temperatures taken as a policy when people enter the building. You may think about doing that. You may want to think about sick workers staying home. The other thing that we're seeing is a lot of flexibility with your employees to stay home and take care of their families. And you need to follow that consistent with the public health guidelines. Creative distancing, staggering work shifts, staggering lunch breaks, remote work for non-production and shipping and delivery, downsizing operations, and delivering services remotely, or even doing video conferencing. Again, hygiene and separation, have a policy and communicate the cost, washing your hands, social distancing policies, again, using placards and partitions. Giving workers time at the end of the shift to clean their workstations is also a really smart thing to do. From a communication, think about where you're going to post these materials. Are you going to do them centrally on a plant floor? Are you going to do them online? Make sure you let them know how often it will be updated. Education, cleaning. Make sure that they understand the dwell times and wiping the surfaces. Again, if they don't leave the disinfectant sit, we aren't killing the germs. So resources. Next page. Another page, please.
Just a reminder, Cindy, since this presentation, I know we're running a little short on time, and the PowerPoint as well as the recording will be available. So I don't know if you want to just kind of skim through this portion.
Just to let everyone know, on the next few pages, there are actually phone numbers and addresses for the vendors. That's it. Thank you.
All right. Well, thank you, Cindy. We'll open it up to some questions. We've already got a few questions that have come in, and three questions. If anyone's still on, or if Cindy, if you're on audio, if you want to mute yourself just to be sure we don't have background noise. Again, this presentation is on, it's actually already on mpma.com on our COVID-19 resource page, so you can pull up the PowerPoint, and then the recording will be available within the next 24 hours. So Cindy, I guess I'll have a few questions for you, and then you can unmute as you're ready to answer. One question, just I think this is something that everyone's been asking. You know, you mentioned a few times about hand sanitizer, and that's been a hot commodity. Is there a way to find that? And you know, who can we find it from? And if not, is there maybe a way to produce your own home remedy?
Hand sanitizer is actually available, and it's in the reference page, but there is hand sanitizer available at the distilleries. That's the easiest way to get a hold of it right now. There is no main supplier that has anyone.
Okay. One thing I thought of is you were talking about like biohazard bags, and you know, my company was a med device manufacturer, so we had biohazard protocols in place. Companies that don't typically have that on hand, you know, a lot of people are making homemade masks right now if they can't find masks. Is there kind of you know, a option to make your own kind of biohazard bags if you don't have access to that? Or I'm not sure if they're available out there right now.
I don't know the answer to that, Steve, but I will research it and get back to you on that.
Okay.
In the meantime, I would call the suppliers on that.
Sure. I know one company said that their contract cleaner responded to their request and said they just didn't have the bandwidth for them right now, which I imagine is probably pretty common. A lot of the cleaning companies are pretty overloaded. If someone just doesn't find the resources, or do you believe there are still plenty of cleaning resources out there that do have capacity and they just need to look around? Or if not, is there an alternative, just basically trying to figure it out on their own?
I would recommend not doing this on your own. I would recommend hiring someone. There are companies still available. Different companies are taking on different sizes. So if you call, for example, Paul Davis, they're not going to take on a facility less than 20,000 square feet. We are doing cleaning. You know, we will take those on. So, well, do I get hold of us? We do have the equipment for that. But there are companies out there and they are working.
Okay. We had a great question.
Doesn't want to, then let us know.
We had a great question that just came in asking about ventilation. You know, obviously when you perhaps introduce positive pressure to an environment, are you blowing the virus around to other areas? Could you spread the contamination through ventilation?
According to the CDC, they're recommending improving ventilation. Now, I would think that you still want to ventilate out into natural air, not into the inside of the environment. But that's what the CDC is recommending.
Sure. And I know my wife works at a hospital, and they've kind of shifted gears from positive pressure to, or sorry, from negative pressure to positive pressure. So it's just something to keep in mind, I guess, when you're, especially if you've got a controlled environment or a tight environment. Another question that someone just had would like some quick clarification on the 7-day process after post-exposure. Can you maybe repeat that?
After 7 days, the CDC said it's okay to go back into that environment naturally. I wouldn't do that. I still would get it clean. But they're saying that the virus on the surfaces are all dead. I still would, as a recommendation, have someone come in.
All right, well, I think that uses up all of our time here. I think we've answered most of the questions that have come in. So I want to thank Cindy from Vanguard for your presentation today. I want to thank everyone for joining us. Our next presentation is going to be on Tuesday morning. We're going to get back to a little bit more of a topic that manufacturers like to talk about other than COVID-19 all the time. Advanced Tech is going to be doing a presentation on 3D printing and how it relates to COVID-19 and how it can be a resource and a solution. But we get to talk a little bit more technical in manufacturing. So hope you all can join us for that. In the meantime, I hope you all take care, stay healthy, take care of your families, and look forward to seeing you again soon.